Hello, everyone, and welcome to On the Move. This is Dr. Brandis Montgomery with On the Move Massage and Physical Therapy. I have a doctorate in physical therapy and practice mobily here in Metro Atlanta, and I'm coming to you today to talk a little bit about knee pain and knee derangements, as we call them in the medical field, because I recently just finished doing a knee pain series on my blog and through my social media following. So I wanted to kind of address the most common knee derangements and what it is that we can do with them, or what does that mean for you as a diagnosis. So commonly we see several different knee derangements, and those include meniscal, ACL, PCL, MCL, or LCL tears. And when we hear those things, we think drastically, like immediately I need surgery, or my career is over if you're an athlete, or maybe if you're not an athlete, maybe just that your life is going to change dramatically due to this injury. And that doesn't have to be the case. These days, knee derangements are commonly treated conservatively first, especially if you're not an athlete. And physical therapy can most times help you get past it without having to have surgical intervention, unless you prefer to opt in to the surgical interventions first off without trying physical therapy. But most doctors will recommend, and surgeons will recommend, that you do try it, because they get so much relief from just changing a few simple movements or position patterns, learning how to turn on and off a muscle, strengthening muscles, and just working on your overall technique with things with a physical therapist, that they don't want you to jump straight to a surgery. So the ways that we can look at those different things would be through an article that I posted in a blog. This was from a while ago, where physical therapy was used to treat meniscal tears, and they compared that to people that chose to do surgery, and they looked at 6-month outcomes, and they found that after 6 months of physical therapy and then post-surgery 6 months, both groups were showing similar improvement. So the surgical group did not show quicker improvement, they didn't show increased improvement. It was similar to that of the physical therapy group. So it goes to show that don't have to jump right to surgery, and a lot of times we can get through these knee derangements without surgery at all. Something to keep in mind. And when we look at physical therapy as the first and most sufficient option for treatment, we need to look at what would your physical therapy look like, and how do we apply this when we are having any kind of knee pain or derangements. And the best thing that you can find when you work with a physical therapist as a movement specialist, that's what we're called, you can find relief of your pain just by learning how to move correctly and putting less strain on your knees to decrease the symptoms that you're feeling. So an example of this might be if you have pain with stairs, for example, and I assess you using the stairs, and I can see what your knee and hip and ankle are doing in those moments, and then that tells me where you might have weaknesses or tightness, or even just a lack of ability to turn on the muscles that you need to use the stairs correctly. And then through a few sessions of showing you and teaching you how to do those things, so many patients of mine that have had knee pain with stairs get relief. So there are simple things that we can look at just through your motion and be able to tell you where you might be able to change a little something here or there, or maybe you're not using a muscle at all or not correctly, and those little simple changes might be all that you. So you hear me saying things like learning how to turn a muscle on, and that might be a weird saying for you, or you're not sure even what I mean by that. And what I mean by that is that you can strengthen muscles all you want, and there are big muscle groups that we use to do certain exercises, especially if you're just going to a gym and you're exercising on your own. More than likely you're doing big muscle groups, and there's nothing wrong with that. But in order to turn on one specific muscle, our brain has to send a signal to that muscle through our nervous system and tell the muscle to contract and activate to do whatever it is that you're asking it to do. So for example, if I'm trying to go up the stairs, I need to be able to use my glute muscles. If I'm going up the stairs and I don't know how to turn my glute muscles on, I'm going to just step up the steps, typically using more knee quad activation and very little glute activation. A lot of times we get to the point, because that's painful, we start to pull ourselves up the stairs with a handrail. We don't even use our muscles at all. We're just pulling with our upper body. So with physical therapy, we can work to teach you how to turn on your glute muscles. Those are the important ones. We want our glutes to elevate us up the step. Think of them as your elevator or like ejection button. They're pushing us up and lifting us up the stairs versus us pulling up the stairs. And so that's something that we would work with you on, both through strengthening exercises to get those muscles strong, but then showing you how to turn them on and use them when you're going on the stairs. And then once we've worked through a lot of those things with the function, showing you how to functionally do stairs, for example, correctly, once we've taught you how to strengthen those muscles, once we've taught you how to activate those muscles, then you start using them in your everyday, and now you allow those derangements of your knee, for example, meniscus. If your meniscus is irritated or has a tear, it gives it a chance to give that meniscus time to heal and breathe, and it's not having irritation to it all the time, and then you get relief from those symptoms. And a lot of times, as long as you maintain those strengthening exercises and or just the technique of using your glutes or using less pulling with your arms, then you may never have symptoms from your meniscus again, or at least not ones that put you down forever. So make sure that you are reaching out to physical therapy if you've had a knee injury. If you're an athlete, quickly reach out to physical therapy. You want to try to get ahead of that as quick as possible. Regaining range of motion, decreasing swelling and inflammation are very important initially. So if you've had some sort of injury, you definitely want to get started with your rehab process quickly. And if you're having knee pain or have been diagnosed with some sort of derangement with just your everyday activity, you definitely need to work with a physical therapist so that they can teach you how to use those muscles and eliminate pain or difficulty that you're having with the derangement itself. If you are unsure where to start with that, please reach out. Let me know what it is that you're looking for, what you're interested in. We can do virtual sessions if you're not located here in Atlanta, or if you are, we can talk about what those sessions would look like and how I can help you overcome that pain and get back to your function and get back to your activities or your sports or your goals that you have for your training and not have knee pain. Again, my name is Brandis. If anyone has questions, I'm here to help. I'm here to answer, and I would love to point you in the right direction. Have a great day, and we'll see you next time.